All right, and with that, our wonderful participants today are Dr. Rachel Herlihy, State Epidemiologist for CDPHE, and Dr. Jonathan Samet, Dean for the Colorado School of Public Health. And so we will start with Dr. Herlihy.
Great, good afternoon, everyone. We're going to start where we usually start, which is with the case counts that we've seen in the state over the last several days. So this is the typical figure we show you where we look at case count trends throughout the pandemic. You can see here the three different waves of illness that we've experienced with the pandemic: the spring wave, the summer wave, and now our much larger fall wave. But keep in mind that that spring wave of illness, we had much less testing available. And so it's quite likely that we did not recognize nearly as many cases as that occurred in the spring compared to the number of cases that we are recognizing now. But I want to draw your attention to the right side of this figure and take a look at some of the recent case data in the state. What you'll notice is that we've seen some fluctuation. We've seen the numbers bouncing around quite a bit in the last 2 weeks or so. You can see that if you look at each of those vertical bars, the more lightly colored bars, those are the daily values. And then the darker red shaded area is showing you our 7-day average. So you can see that that 7-day average has really been kind of hovering in that 4,000 to 5,000 range of cases per day, but lots of daily variability that we're seeing. We did see a decrease in case counts reported over the holiday weekend, but if you look at the last bar in the figure, which is today's value, you'll see that numbers have come up quite a bit just today. It's difficult to know right now what the next couple of days are going to look like. We'll talk in a couple of minutes about when we might expect to see an increase that could have been associated with the Thanksgiving holiday. We are not seeing that data yet. It's really going to be probably several days until we start to see the impact of any gatherings or decreased social distancing associated with Thanksgiving. But right now, I think the takeaway is that numbers are moving around quite a bit. They're down a little bit from what they were about a week ago, but we have seen a little bit of an increase just in the last couple of days. Next slide. Similarly, if you look at this figure, which is our percent positivity data, or the percentage of tests that are being done in the state that are coming back positive, you'll see that the numbers have been bouncing around a little bit from week to week for the last couple of weeks, but have continued to be in this 11 to 13% of tests coming back positive, really for the last 4 weeks. And that's really a trend that has been pretty persistent since really the end of October. We've seen these higher levels of percent positivity, keeping in mind that our goal is to really try and be below 5%. We know that once we get above that 5% level, that's an indication that we're not detecting perhaps as many cases in the state and that transmission levels are higher of this virus. Next slide. This next figure shows you hospitalization trends in the state. So unlike the case data and the percent positivity, where we've seen the numbers bouncing around quite a bit, we've really continued to see a steady increase in the number of individuals currently hospitalized in the state. We saw a little bit of a dip in new hospital admissions, but overall, the number of individuals currently hospitalized for COVID-19 in the state does continue to steadily grow. And that really is because we are seeing the COVID-19 hospital admissions really outpace COVID-19 hospital discharges, meaning that more people are still coming into the hospital than are leaving the hospital after recovering from COVID-19. So again, the trends really continue to steadily increase. We continue to see a growing strain on our healthcare system throughout the state. Next slide. So I want to talk a little bit about when we might anticipate seeing some of the impact of the Thanksgiving holiday. As we know from previous holidays in the state during COVID-19 transmission, so the 4th of July holiday and the Labor Day holiday, we know that with holidays, we have seen less social distancing occurring, with these gatherings occurring between multiple households at times. And because of that, with those other holidays, we did see a bump in the number of cases. So we're tracking this carefully over the next couple of days and weeks to really try and understand what sort of an impact we might anticipate experiencing from the holiday. And so right now we're anticipating that we'll start to see some of the earliest cases that could be attributable to transmission occurring on Thanksgiving starting around December 7th. So it's really not going to be until next week that we start to see the clear impact of the Thanksgiving holiday in the state. We're certainly hoping that we are not going to see a significant increase in the number of cases in the state following the holiday, but we know that that is certainly possible, and it is something we're going to be watching for carefully. Next slide. With that, I'll hand it over to Dr. Samet.
Okay, thank you very much, Dr. Hurley, and good afternoon, everyone. So I'm going to give you the findings of our latest modeling update. I think, as you all likely know, our modeling team from the Colorado School of Public Health, Medicine, CU Boulder, Denver, and CSU regularly updates our models based on what is happening in Colorado. This slide shows the latest fit of the model to the data. And following on what Dr. Hurley said, we're looking at data here through November 30th. So we don't yet see the impact of what might happen with mixing over the holiday. The magenta curve at the bottom is the latest estimation of the trajectory of the epidemic in the state. So if you look on the left, we're modeling the counts of people in the hospital, which has been rising, as you just saw, and the curve projects how that rise might occur. Now, there's good news here in that the magenta curve is well below the teal curve. What this indicates is that our transmission control has improved. The R value, the effective reproductive number, has dropped, and the black line shows the actual data, which has been now tracking along this bottom curve, which has a more gentle rise. The number of individuals in the hospital today is actually a drop from yesterday at 1796. These numbers, of course, bounce around, but we did not see a rise between today and yesterday. So in a sense, this is the good news. The bad news side is that the curve is still rising. R is above 1, and transmission control optimally would be higher. Next slide, please. So here I'm going to show you the value of R, the effective reproductive number, over time. It, of course, started very high at the start of the epidemic. That's when we use the term R naught. And over time, it has gone below 1. For example, if you look at May through June, when we were still experiencing the consequences of the stay-at-home measures taken. But if you look at more recently into the fall, you'll see the rise that went on for almost 2 months. And the good news is that we've dropped down from the peak value, which was almost 1.7, to the most recent value of around 1.2. Our model also estimates something we call transmission control. Next slide. And those values are shown here. Now, the value of transmission control goes from 0, which is pre-COVID-19 when we were freely mixing, and as you can see where we were in March, to 100% if we were truly locked in our homes, literally, and not going out and mixing with others. You can see that again, transmission control dropped heading into June, and we had that July peak. More recently, we've seen a decline in transmission control. And then now the last few weeks, we have seen a rise in transmission control. So that is good news. But again, we await the impact of Thanksgiving, and of course the December holidays are still to come as well. So next slide. So this slide shows two sets of figures. So one is the actual reported hospitalizations in blue. Remember, that's 1796 today. The axis on the right side. On the left is orange. And this is the estimated number of active infections. That is the people on any particular day who might be infected. This is given as the rate per 100,000. So remembering that a substantial proportion of the cases are asymptomatic and, of course, not picked up by CDPHE, we use our model to estimate how many people are infected. And that's where these estimates of 1 in so many Coloradans are infected. Right now, that number is 1 out of 40. It was about the same last week. I think we said the figure is 1 out of 41. What this means is that with the infection so widespread, there's a high risk of contacting, of susceptible individuals contacting someone who is infectious, of course, which is how epidemics propagate. And I think this indicates the seriousness of the situation that we are in at this moment. Next. Now, what I'm showing you here is hospital demand as we project it out. If we were to stay on this current trajectory of 71%, remember at 71%, as you see here, the epidemic curve continues to rise. We're showing some uncertainty in this red band around the green central line. This is probably not how things will play out because measures will be taken. And again, as I've mentioned, we don't have the consequences of Thanksgiving here, nor the December holidays to come. Nevertheless, we get, I think, a pretty good picture of what will likely happen in the next few weeks with the continued rise of the curve, the number in hospital, although staying below, and fortunately well below the estimated total capacity to care for patients with COVID-19. The next slide shows the same, but now for ICU demand. The dotted line up at the top shows the threshold estimated for care of patients in the ICU with COVID-19. Again, projecting on the current trajectory, we have continued growth because R is still positive. So the line will continue to go up. Again, on this scenario of staying where we are, staying below the ICU threshold. Now, in the next, we've tried to think about and project what will happen or could happen with the holidays. So here we have a thin gray band on the left side corresponding to 4 days at the Thanksgiving holiday, and then a thicker one on the right side corresponding to December 24th through January 1st. What we're saying here is what would happen, could happen, if there was a lapse in control, the transmission control, of either 10%, that's sort of the orange line, or of 20%, the darker line. So again, if we're on the current trajectory and we had a lapse at Thanksgiving of either 10% or 20%, and a lapse at the Christmas, New Year's holidays of 10 or 20%, what would happen? And what you can see if we stayed on the current trajectory with no lapse, we're in the darker curve at the bottom that does not bump up. What you can see on the curves for hospitalization on the left and ICU on the right, showing the number who would be in hospital or in the ICU, you can see those bump ups that take place with holiday-related lapses of control. So this, as you can see on the left, stays below the threshold value for hospital capacity of 6460. On the right, with ICU, a 20% lapse takes us very close to that threshold. And, of course, these estimates are subject to great uncertainty. So just want to point out that holiday lapses from where we are now could put us at a point where we could be stressing our hospital care capacity. Now, the next slide shows a different case. And in this situation, we have a reduction of transmission control to 60%. We were at that level about 3 weeks ago when the epidemic curve was rising very steeply. Unfortunately, we've backed off for that. But it could be that if there are a general lack of adherence to the transmission control measures we all need to take, if we went back to 60%, and had further lapses, I think you can see that now these curves rise steeply, and looking to the right are projected to exceed the ICU capacity, the dashed line of 1325, substantially. So, again, I think this points to the need for continued maintenance of as much as high level of transmission control as possible. We have Thanksgiving behind us, but we don't know what it has done, as Dr. Hurley pointed out, yet. And we await what could happen over the longer expanse of the Christmas New Year's span, December 24th to January 1st. Now, next, I'm just going to show you some of the projections of potential deaths. This is cumulative deaths from the start of the epidemic in Colorado. So if you notice, the scale on the left is simply counts under some bounding scenarios. So the bottom on the right is if we were to go to 80% and just stay there. And 80%, the R value is below 1. So the curve would have bent and be going down because transmission has been suppressed. At the top is a scenario we certainly want to avoid, that drop in transmission control overall to 60%, plus a 30% reduction at the holidays. And you can see that then the cumulative deaths would be substantially greater than under the 80% scenario. And I think the point here is that we need to be maintaining as high a level of transmission control as possible, particularly when these likely holiday mixing, increased mixing is superimposed on where we are now, not having R below 1, i.e. being on the 80% line. So the next, please. So just a quick snapshot. We still have a reproductive number above 1, estimated right now about 1.2. We still, because of how steeply the curve rose and how many people became infected, have a high prevalence of infection across the state. We estimate that around 16-17% of the Colorado population has been infected to date. That's a substantial percentage, but of course it's nowhere where we need to be to achieve herd immunity. And the 71% transmission control figure is certainly better than where we were several weeks ago. It is not where we want to be, and we're certainly concerned that the additional reduction of transmission control that's likely with the holidays will increase what we see beyond 71% itself. So with that, I'll turn things back to Dr. Hurley.
Great. Thank you, Dr. Samet. So the last topic we wanted to cover today is to update you on the new quarantine guidance from CDC. You've probably heard a little bit about this. So yesterday, CDC did announce that there are new options to shorten the quarantine period under certain scenarios. So both CDC and CDPHE continue to recommend that really the 14-day quarantine period is really the gold standard. So we know that that 14-day quarantine period is really going to be the best quarantine duration to minimize risk of further transmission of this virus. But we do know that now there are some data that are showing us that it is possible to shorten quarantine using either a test-based strategy or not using a test-based strategy. And the two options that CDC has shared with us are a 7-day option and a 10-day option. Both of these options do come with more risk than quarantining for 14 days, which is why we continue to recommend the 14-day period really as the best strategy. But we think that these other options should be available for the right scenarios as shown here. So for the 7-day scenario, If you do not develop symptoms, you may be released from quarantine after day 7 if you have a negative test. And that can either be a PCR or molecular type test or an antigen test that is collected within 48 hours. Under no circumstance can that quarantine period end before the end of that 7th day. The other option, which does not involve testing, is a 10-day quarantine. So if you do not develop symptoms and you continue to monitor your symptoms daily through your quarantine period, you may be released from quarantine after 10 days without a test. But with both of these scenarios, we really want people to continue to monitor themselves for symptoms for that entire 14-day period, even if they end their quarantine early, because we know that under these shortened quarantine scenarios, there are going to be a small percentage of people that could potentially go on to develop infection if they do not wait that entire 14 days for their quarantine period. So again, continuing to monitor symptoms through that entire 14 days is going to remain an important strategy for all scenarios. Next slide. And so finally, our recommendation to all Coloradans now is to cancel gatherings with people who do not live with you. That includes upcoming holiday planning, wearing a mask when you must go out, and staying at least 6 feet away from others at all times. And with that, I'll hand it back to Heidi.
Great, thank you both so much. So now we will take a couple of questions. Before we get started, we'll use the raise hand function to go ahead and get in line. And then if you have any questions that are about the vaccine plan or on a different topic than we've discussed today, please send those to media_info@state.co.us. And I'm going to go ahead and start calling on you. If you could say your name and which outlet you're with. And I'm going to start with Vinny.
Hello, this is Vinny Daljudice at Bloomberg News in Denver. On the modeling data, I want to make sure I get this straight. How many new deaths are projected between now and the end of the year in Colorado? Am I 3,000 or 5,000 under the worst case scenario? And secondly, why did the epidemic curve start rising 3 weeks ago? What's the best guess? Thank you very much.
Okay, so 2 things. The epidemic curve, actually the R value rose for several months, and in fact, only in the last 3 weeks has the rate of rise slowed. So if you look at the graph of transmission, the transmission control value, you'll see it dropping sort of mid-September through about 3 weeks ago, and then fortunately beginning to improve. A couple of comments about the numbers of deaths. I think so far the cumulative number of deaths for individuals with COVID-19 is above 3,000. So these projections I know look startlingly high, and we hope they aren't played out. We do, in our models, take account of the improved survival that fortunately we've seen recently, but under some of the scenarios, you are correct, the numbers could go up by as much as several thousand deaths. Just one other point, we don't have a full picture of the number of deaths over time until the registration, the identification of deaths has taken place. So we're always have a little bit of lag. So our current numbers, unfortunately, are probably underestimates of what has actually gone on. So I think that the underestimation now makes these projections look even higher, startlingly high, as I think motivated your question.
So does that mean under optimum conditions, we're going to see another 2,000 deaths in Colorado between now and the end of the year?
Well, those are the projections and estimates. I will, any person who models will say these are subject to uncertainty, and we're trying to represent what could happen under the inherent assumptions of the models. I think given the fact that we've experienced rising cases and hospitalizations, there's no doubt that the numbers of deaths will rise. And I hope that our numbers are overestimates, but I think we're facing a number of deaths that's far greater than we would like to experience.
So it's pretty grim between now and the end of the year.
Well, I think this is a really tricky month ahead. And I think, CDC Director Redfield spoke directly to that yesterday about the next 3 months. We are at a point where the epidemic has worsened across the country, and of course in Colorado for probably many different reasons. And we have a population that is fatigued with doing what it needs to do. So I think I don't like to be a grim prognosticator here, but if the curve keeps rising, as the R value suggests it will right now, we will see more hospitalizations, more cases, and more deaths.
Great, thank you. Meg, I'm going to take it over to you, and if you could say which outlet you're with.
Hi, this is Meg Wingeter from the Denver Post. You said about wanting to get transmission from 71 up to 80. How can a person look at their own life and say, okay, I'm at this level of control and here's what I need to be doing or stop doing?
Right. So, Meg, so the 80% we represent as where we would like to be. Everybody would like to have the transmission being reduced, the epidemic under control in the state, and we need to get about 80% transmission control to do that. That's shown as sort of an optimal, almost bounding case where we'd like to be. I think you indicate, I think the problems in getting there. How could we do that while maintaining the degree of openness that we all need? I think for the short term, I doubt that we will head to a level of transmission control of 80%. Have concerns that we could, in fact, because of holidays and sort of the general phenomenon of not having the adherence we need to transmission control measures, we could go in the wrong direction. So, I think the message is, and I think Dr. Hurley, he delivered it. We have to keep doing all those things that we have said over and over again. Everyone needs to do, and that does mean giving up those kinds of events that lead to mixing. So if we could persuade everyone to do that, if Coloradans do that, it would make a tremendous difference.
Great, thank you. Next, I'm going to go to, you're listed as Bueno Rivesta. I don't see my name. Let us know who you are and what outlet you're with. Thank you.
Matthew Garcia with Buena Rivista from Pueblo, Colorado. I had a question. Given that Pueblo will be hosting the football state championships this weekend, do you anticipate a surge related to that event in Pueblo County or related communities?
Yeah, this is Rachel. I can take that. So, I think it's important that, in all scenarios for gatherings of any type, that we continue to use the strategies that we've been using. So maintaining that social distancing at least 6 feet from all people, ensuring that individuals are wearing masks. Anytime that a large number of people come together, there is the potential for disease transmission to occur. We know that risk can be decreased, though, with all of the strategies that we use. And so I would certainly encourage anyone that might be attending that event in Pueblo County or any event, and whether those are indoor events or outdoor events, to really make sure that they're practicing social distancing and following public health recommendations.
Great, thank you. We're going to take it over to, you are showing up in here as T, if you want to say who you are and which outlet you're with.
This is Thomas Pipert with the Associated Press. This is for Dr. Hurley. I have a question about the recent COVID vaccine distribution test in which only half the shipment arrived. What are the consequences of receiving only part of a shipment if this was the real deal and not a trial run? And can you also speak to the importance of doing these test runs with the CDC before the real thing occurs?
So I'm going to actually jump in on this one and say that if you want to send your vaccine questions over to the media info box, we're happy to help get you some answers. Did you have any questions about the modeling data today?
I've sent multiple emails to that inbox and haven't gotten a specific answer, so I wanted to reach out to Dr. Hurley.
Okay, well, we can follow up with more specifics and check in on that. Did you have any questions about the modeling data? If not, then I may move on but I definitely want to make sure we answer any of your questions about the modeling data.
No, you can move on.
Okay, thank you. And we'll get back to you from the media info box. All right, John Ingold, if you can say which outlet you're with.
Hi, everyone. It's John Ingold from the Colorado Sun. Thanks for taking my question. I have a question about the 16.5% of the population that's been infected to date. And I'm wondering, so the model would assume that they are no longer susceptible. And I'm wondering what you are learning so far about reinfection, the potential for reinfection, for how long those people would remain immune before they circle back around into the susceptible pool.
Right. So no, great question. Actually, one we've been thinking about. And, you know, the answer, of course, in part is that we don't yet know how long immunity lasts and how long effective immunity lasts. And there's work on that. We've taken a look at that in terms of what if people only had effective immunity for 90 days and stretched that out to 300, because individuals who were infected at the start, now a substantial period has gone on, and perhaps they are not immune anymore. The answer is what you would expect. So what we do now in the models, we assume that once somebody has been infected, they are not going to get it again. If we start to put people back in as early as 90 days after the infection, the epidemic curves will get will grow. They will be higher, of course, because the number of susceptibles is large. We've looked at the literature to try and guide our model assumptions, and it's mixed, as you probably are aware. But I think, you know, somewhere around 4 to 6 months, there's indication that immunity could be waning for some, and perhaps Dr. Hurley, he can speak to this, but there are a number of cases reported as individuals as reported as having recurrent or second infection in Colorado.
Right. So we have observed, I think, around 300 of those instances here in the state of individuals who had a previous positive test and then have tested positive again. But I think the reality is, with so much testing occurring, especially repeat testing occurring in high risk settings, which is exactly what we want to be happening, it's difficult to know if those are individuals who would have potentially been able to spread the virus or not. We really don't know, you know, to what degree individuals might have, you know, if they were to be infected again, if they're going to have mild illness versus more severe illness, or the ability to transmit that virus to others. So I think there's unfortunately lots of things we still don't know about reinfection with this virus.
Great. Thank you.
Oh, thank you. I know that we haven't had a chance to get to everyone's questions. I can take one more, and then if you have any questions and we didn't get a chance to get to you, please send those to media_info@state.co.us. And Blair, if you could say which outlet you're with.
Hi, it's Blair Miller with Denver 7. Two short, brief questions. One, have you seen any data from the Thanksgiving holiday from wastewater or transportation data that would give you any early indications about Thanksgiving? And two, Dr. Hurley, did I hear you say that we should probably consider not getting together for Christmas as well? Thank you.
Yeah, so to your first question, I have not seen any wastewater data yet, but we do receive data in partnership with CDOT and look at traffic camera data. And we have noticed that on Thanksgiving Day, I believe there was an average of about a 27% reduction in traffic that day. It's difficult to know exactly what that means. It certainly seems like an indicator that individuals changed plans or did something different this year compared to what they did in 2019. But difficult to know if people, who did still travel went to the mountains and stayed in a cabin with just their family, or went up to the mountains and gathered with a large number of individuals. So difficult to directly translate that to social distancing type behavior. And then what was the second question again? Sorry.
Oh, it seemed like at the end, right before we got to Q&A, that you were hinting that people should consider not getting together for the next holiday as well.
Yeah, so I think we're going to learn quite a bit in the next week or two about the impact of Thanksgiving. As Dr. Samet said, we think that we probably will see some level of decreased transmission control. We think it's unlikely that we're probably going to see substantial gains in transmission control. So I think it's quite possible, at least with what we know right now, and again, we'll learn more in the next week or two, that gatherings of multiple households at Christmas will be risky. I think that's unfortunately a reality, that we will probably not see a tremendous decrease in cases between now and then that would lead to those gatherings being much less risky than they are now.
Great, thank you. And
Thank you.
again, I wish that we had more time for more questions, and I know we didn't get to all of them, but I want to say thank you. And if we did not get to your question, please send those to media_info@state.co.us. And with that, thank you, Dr. Herlihy and Dr. Samet and Abel, our ASL, and everyone else. And I hope that you have a wonderful rest of your day. Thank you.